We've met again for another interesting episode of your Oral Health Corner. The last time we spoke about tooth loss, and we said when you lose your tooth, it can affect your speech, it can affect your appearance, it can affect the arrangement of the teeth, it can even affect how you chew. Today we are not going to look at that one again. We are going to look at replacement. When you lose your teeth, what are the options available for you to replace your teeth? So we'll categorize them into two main groups about the teeth, the artificial teeth or the teeth replacement. We have the removable one and we have the fixed one. The removable one, we usually call it denture. That one we call it removable because when it is fixed for you or if it is done for you, you can remove it and you can insert it as and when you want. Now the denture comes in various forms. We have the metal-based one, which is not usually common nowadays, but they are there. Then we have the other ones like the Varplus and then the acrylic. The Varplus is also known as a flexible denture. Now the negative aspect or the inconvenience aspect of the denture is you having to remove it every evening or every night if you are going to sleep, and then in the morning cleaning it nicely and inserting your teeth back. That's the inconvenience aspect. People don't want to remove it and then insert. Denture could also even be implant supported. Sometimes an implant is done under and then the denture is fixed over it. Then we have the fixed one. The fixed one, we are talking about implant and bridges. The implant, a metal is inserted into the jawbone, and now an artificial tooth is fabricated, that's crown, and then fixed on it. It's usually the ideal replacement. Then we also have the bridge. The bridge has to do with the concept of the bridge that we know. So we normally use the adjacent teeth as the pillar to hold the missing tooth. Now with the bridge, we have the conventional one where the two adjacent teeth are used as the pillar. Then we also have another form, the bridge. We have about three of them, the conventional. We have also what we call the cantilever, where only one side is used as the pillar. So instead of the two side adjacent teeth being used, you can use only one side as the pillar. So the missing tooth will be hanging more or less. We also have another one called the RBB, the racing bonded bridge or the Maryland bridge. It's a type of bridge that has a wing, usually for replacing anterior teeth. So the wings are bonded to the adjacent teeth as the pillar, then the missing teeth is replaced. Now, as to whether denture or bridge or implant is the best one for you, depends on the health of the other teeth in your mouth, and then also the size of your pocket, the amount of money you have. Now, whichever one you choose, you have to decide with your practitioner, the dental care provider, and then they will choose what is ideal and proper for you based on the size of your pocket and also based on the health of the teeth. Thank you so much.